thank you very much for the opportunity to join this Congress, to Dr. Mayola and all the organizers. This is a wonderful venue. I'm sorry I missed the last one last year, actually due to poor internet connection, ironically, but glad to present this year. I'm a surgeon and a surgical oncologist specialist in upper GI tumors at Penn State College of Medicine in Hershey, Pennsylvania, and delighted to join you to talk a little bit about our experiences with Twitter as a pancreatic cancer medium for chats. So some colleagues and I have been working for several years on pancreatic cancer Twitter chat. So the Twitter chat, Panc Chat, is a online monthly 1-hour chat that's organized by a foundation called Let's Win PC, pancreatic cancer, as well as several other pancreatic cancer organizations in the United States and globally. And we have 4 physicians who are the hosts of the Panc Chat, and I happen to be invited to be one of them. To step back to understand the need for this, pancreatic cancer is a very dismal cancer, as you all know, with a very poor prognosis. In the United States, it's the 3rd leading cancer killer. It has a less than 10% 5-year survival. And as a result of this, and because the treatments are quite difficult, there's a lot of nihilism or negativity about pancreatic cancer. Therefore, when patients hear the word pancreatic cancer or their caregivers, they're not aware of even basic facts, and they just mind is filled with fear. Many desire additional patient and physician interaction because they feel that their own doctors are not always as accessible because they're busy. And we thought that social media would be a great educational resource to fight some of the misconceptions that are out there, provide excellent information from physicians and other experts, and to help patients and advocates, caregivers, and others join together to talk to each other in a chat. So our goals would be to provide evidence-based information, provide a community to support all of the members of the pancreatic cancer family, and to provide guidance and general advice. We never, of course, give specific medical advice on the Twitter chat, and to dispel myths, to really help patients and others understand that there are options available. I'm a surgeon, so I'll talk about the reach of one of our Twitter chats that was focused on pancreatic cancer. So we have a variety of topics, and there's a cycle every year of certain topics, including surgery for pancreatic cancer, clinical trials, genetic testing, advocacy, and so on. Recent chats have also included the role of COVID-19 for pancreatic cancer patients and cancer patients in general, and other timely topics. So in April 2018, and again in 2019, we tackled the topic of surgical intervention for pancreatic cancer. And you can see just this is a simpler analysis of our 1-hour Twitter chat. And there were almost 800 tweets and almost 3 million impressions. And in fact, more recent tweets have garnered anywhere between 3 and 4 million impressions. And what I think is amazing is 116 different participants. So we're really bringing together, much as this forum is, an entire global community. And we've had the chat at different times of the day to try to accommodate people in different parts of the world. And so I think we have a chance to reach a lot of people. And we have good data that patients trust their physicians the most on social media. So they're willing to listen to information and share information from physicians much more than hospitals, drug companies, and so on. So I think it's our obligation, as discussed in one of the previous presentations, to give good information and drown out the bad information. A colleague of mine, Dr. Deanna Atai from UCLA, runs the breast cancer chat and has some data that shows that her breast cancer chat in a survey resulted in decreased anxiety in 60% of the patients, increased information in 80% of the patients, and up to 30% of patients would go to their doctor to ask for additional information based on the Twitter chat. So I think we're providing very good information that elevates the level of discourse and understanding of all of our patients. Of course, most of us are academics doing this, and so we have been able to leverage our Twitter chat for academic purposes as well. These are some presentations we've had at the ASCO GI meeting in 2018 and the full ASCO meeting, which was virtual this year in 2020. And we have an ongoing effort to look at our pancreatic cancer chat content, to learn from it, and to publish about it. I think I'll stop at this point, and happy to answer any questions and invite you all to visit in person once COVID is gone to Hershey, Pennsylvania, the sweetest place on earth.
Thank you very much, Niraj. Any questions? So I will start. What was your personal motivation to engage in this kind of activity? Because initially this was not easy. This was something different, and there are always barriers, or there are always justifications to avoid getting engaged on social media. What did you do, or what moved you to do it?
Yeah, it's interesting. It's a progression, as with anything. Initially, it's a way to pass some time and do some things in between cases or while waiting for turnover or waiting for a study. But then it became obvious that Twitter, especially, I'm pretty strict about separating my personal from my professional social media. But Twitter was a very good way to stay professional, provide information in very short bits, so you don't have to spend a lot of time writing your tweets. I have learned better writing from making them short, but it's a way to get information out there. And then I realized the thing I'm passionate about is cancer care and getting information to patients. And so I realized that patients in our clinic don't hear anything you say because they're scared. And then when they go home, they ask all the same questions. So this is a way to get that same information out there in another forum. And then it grew from there, and I found other people who have been allies and supporters in this. Alexander
asked a question for the previous presenter, but it can be really addressed by all of us. It was regarding Instagram. He would like to know how what kind of permission or consents we get to use patients' data or patients' info in general. In the United States, there are restrictions. There is regulated. In Europe, it's also regulated. How do you handle it?
Yeah. So now our hospital's consent for treatment includes, consent that your images, as long as they're de-identified, will potentially be used. I specifically ask when I'm taking photos in the operating room of the patient and family, and I'm very, very careful to de-identify to the images. As we all know, the image files have a lot of metadata that can be used to identify. So I try to scrub that by changing the format several times and make sure that I never post anything in real time or with anything that can be used as patient identifiers. I think this is critical. We have to protect our patients and be careful as professionals.
That's a very good point, is don't share anything in real time, because then people can be really identifying. If you post something about this big mass in a patient that I operated today on, then it's going to be very easy to identify the patient. So we must be careful with that. Alexander, any other questions? And how much time did you devote to this, Niraj?
Yeah, probably too much. Again, I try to limit it to in between kind of other things, and to limit family time. These chats are in the evening, so I'm mindful of that. The key is that I have actually, because this has become part of my professional profile. I'm kind of giving talks on this and writing papers on this, and so it's part of my academic work, and I enjoy that part, so I use the time. Certainly you can get sucked in and end up spending way too much time, so you have to be careful. I always say that social media is free, but the cost is your own time.
Yes, and time is precious. Thank you very much, Niraj. It was a wonderful presentation.